I'm Dr. Ashley Gordon from Restore Austin Plastic Surgery Center, and I'm here today with my business partner, Dr. Dustin Reid. Let's talk about this case today. This is a young patient that presented to me, significantly affected by her breast asymmetry. Really just doesn't really prefer one or the other, just really just wants them to be similar.
Yeah, I mean, what a great case. I feel like the way I would approach this is basically it's a breast reduction, but more reduction on one side than the other. That's going to be the most straightforward way to approach it. If she said she wants to be the size on the smaller side as she is on the bigger side, then I would need to do implants, but it sounds like she just wants them to be the same. So I would do a reduction lift on both sides with more reduction on the right side.
Yeah, and that's exactly what I did. I did do a little bit of fat grafting to the left side as well, and some liposuction on the, the side boob on the right side. Because one of the things that's so challenging about these cases is not just the volume of the breast, but just that, the left one is just so much more narrow. It's not just smaller in volume, it's just smaller all around, and the right side is just so much wider. So I added the fat superiorly and to give her more width, to just try to get them to be more symmetrical, telling her that probably at a year we might have to do a little bit of tweaking, which I always tell these patients because I think it's really hard to just knock it out of the park the first time. So still has a little bit of swelling, but I think she's definitely happy because she's a lot closer. Hopefully that right side is going to continue to settle a little bit and become a little bit smaller. I think her grafts took well on the left and she's thrilled, but we might have to do a little bit of revision at a year.
I think that's a great result, and I think that you pointed out something that we really, I think both of us have adopted in our practice, which is with liposuction being able to shape the breast, particularly out laterally, and then using that fat sometimes to use it where we need it, and I think that's a great result.